Hey everyone, Johnny here. I'm a gastroenterologist in New York City. As you know, the incredible actor Chadwick Boseman recently passed from complications related to colon cancer. He was diagnosed with stage 3 disease involving the wall of the colon in 2016 and then progressed to stage 4 metastatic cancer. He was incredibly brave, continued to make films and chase his dreams, all while receiving treatment in his battle with colon cancer. He led with exemplary strength, humility, and selflessness. In his memory, gastroenterologists throughout the country have been inspired to better educate and raise awareness regarding the dangers of colon cancer and the importance of getting screened early. I'm very proud and honored to share this platform with multiple gastroenterologists, many of whom I look up to, have learned so much from throughout my career, and are leaders in the field of gastroenterology. We presented this video with the goal to promote the best gut health, primary preventative measures, and to raise awareness and education regarding colon cancer.
In 2020, with social distancing being a huge part of what's become the new normal in our lives, one of the concerns that we as gastroenterologists have is the risk of missing colon cancer. And with the passing of Chadwick Boseman recently, there's been a real highlight on the importance of colon cancer screening. Did you know that colon cancer is the third most common cancer in the US and the second leading cause of cancer death in the US? It's expected that this year alone, nearly 150,000 new cases will be diagnosed.
Colorectal cancer incidence has been rising worldwide, especially as developing countries are becoming more westernized. However, in the past 20 years in the United States, the incidence of colorectal cancer in people 65 years and older has decreased, and this is thought to be due to higher and more effective screening systems.
Based on the surveillance, epidemiology, and end results data, the overall 5-year survival rate for colon cancer is 63%. Now, if the cancer is actually found where it started, which means it's localized, the overall 5-year survival rate is 90%. However, if it's spread to the local tissues or surrounding areas or even the lymph nodes, this number actually drops down to 71%. Distant spread, which means spread to the far away organs, drops this 5-year survival rate to 14%.
Colorectal cancer incidence among people younger than age 50 has been rising since the mid-1990s, and no one knows exactly why. Right now, approximately 11% of colon cancer diagnoses and 18% of rectal cancer diagnoses are being made in people younger than age 50, and that percentage is only projected to rise in the next few years.
Colorectal cancer symptoms can vary depending on the size and location. They can range from no symptoms at all to unexplained weight loss, decreased appetite, changes in bowel habits, changes in stool consistency, or rectal bleeding. Also a finding of iron deficiency anemia on labs.
Risk factors for colon cancer include a family history of colon cancer, especially in parents, siblings, or children, or a familial genetic syndrome such as Lynch or FAP. If you have a personal history of precancerous colon polyps, also known as adenomas, if you have inflammatory bowel disease like Crohn's or ulcerative colitis and is poorly controlled, other medical conditions like obesity and diabetes, and certain lifestyle factors including smoking, moderate to heavy use of alcohol, and high intake of red or processed meats.
So in 2015, the World Health Organization actually declared meat and processed meat as probable and type 1 carcinogens respectively. And studies have actually shown that up to 50 grams of processed meat a day can increase your risk of colorectal cancer by as much as 18%. And that's only about 4 strips of bacon or 1 hot dog. Ooh.
Black men and women have the highest incidence of colorectal cancer in the United States. In fact, colorectal cancer rates are about 20% higher in Black Americans than non-Hispanic whites.
And when it comes to mortality rates, the health disparities are even more severe. Compared to non-Hispanic whites, the death rate for Black people is 40% higher with colorectal cancer.
Native Americans have the second highest colon cancer rates after Blacks. Screening rates in Native Americans, Blacks, Asian Americans, and Latinos remain lower than screening rates in whites.
Latino men were found to have a higher incidence of advanced disease, while Latinas were found to have a higher incidence of rectal cancer compared to other ethnic groups.
Although colorectal cancer is the third most common cancer in the United States, it's the second most common cancer amongst Asian Americans. Asian Americans are the fastest growing minority in the United States, but have the lowest rates of colorectal screening. 52% of Asian Americans between the ages of 50 and 75 have not undergone colorectal screening. That's compared to 66% of non-Hispanic whites.
The purpose of screening is to detect colorectal cancer early when treatment works best. It can also find and remove precancerous growths or polyps from the colon. The American Cancer Society currently recommends that screening start at age 45 in people of average risk. Previously, their recommendations had been to start screening at age 45 in African Americans and at age 50 for others. Some society guidelines still advocate starting screening at age 50 in non-African Americans.
People who are in good health should continue regular colorectal cancer screening until the age of 75. For those aged 76 to 85, the decision to continue screening should be based on a person's personal preferences, overall health, life expectancy, and prior screening history. If you have a family history of colon cancer or an underlying condition such as a polyposis syndrome or inflammatory bowel disease, these recommendations may change, and you should talk to your doctor about when to start screening.
Screening can be done with a stool test, CT colonography, flexible sigmoidoscopy, or a colonoscopy. A colonoscopy is the gold standard as it allows us to directly visualize inside your colon to remove precancerous growths known as polyps before they develop into cancer.
A variety of tests are endorsed for screening by major guidelines. We advise colonoscopy for most patients at average risk for colorectal cancer. If the patient is unable or unwilling to have a colonoscopy as the initial screening, or when access to colonoscopy is limited, we advise screening by either a fecal immunochemical test for cold blood once a year, a Cologuard test every 3 years, or a CT colonography every 5 years. Every positive colorectal cancer screening test other than colonoscopy should be followed expeditiously by colonoscopy to visualize the entire colon, evaluate lesions, and remove polyps.
Most colon cancer develop from a polyp. What's a polyp? A polyp is a growth on the inside of the colon that can look like a mushroom that comes in different size and shape. Most polyps do not cause any symptoms, so most people who have polyps do not realize they have them until they get a screening test like a colonoscopy. Polyps in themselves are harmless, but some polyps over time can turn into cancer. By removing polyps at the time of colonoscopy, we can prevent colon cancer.
Get regular exercise. Aim for 30 minutes of moderate intensity exercise for at least 5 times a week. Avoid toxic substances such as tobacco and avoid or minimize your alcohol intake.
To optimize your health and reduce your risk, increase your fiber intake from whole grains, fruits, and vegetables. At the same time, decrease your red meat and processed meat intake. While we may not have control over genetics and family history, we do have a lot more control over this disease than we believe. And while these strategies don't guarantee you won't get colorectal cancer, they certainly improve your health and decrease your risk. Too many lives have been lost from this disease. Together we can prevent and detect early cancers before they progress.
As my colleagues have detailed, countless lives are lost every single year to colorectal cancer. But we are not helpless. We are not powerless. We can combat colorectal cancer. Early detection of polyps can prevent cancer altogether. And detecting cancer at an early stage can be treated very effectively. The point is, it all begins with a conversation between you and your provider. Talk to them about your signs, your symptoms, and learn your individual risk for colorectal cancer. It can be prevented, it can be treatable, it can be beatable. Please, share this with someone you love, share it and take it to heart yourself. Together we can make a difference in the fight against colorectal cancer.